Welcome to our Interprofessional Simulation Center. So first we're heading into one of our debriefing conference rooms. We've got a simulation in action today. So here we've got a couple of our students from both occupational therapy, nursing, some of our social work students and dietetic students are all joining and working together today on an interprofessional simulation. So we're observing our peers in action, we're thinking about what we might do differently, we're preparing for and setting the stage for the patient we're taking care of today, and then we're all going to come back and gather and talk about, as a healthcare team, what did we learn, what can we do differently, and how does this impact our future practice. Next, we're going to head right into one of our simulation rooms to be able to see those students in action. So welcome to one of our interprofessional simulation suites. So as you can see, this room is set to look like a hospital room. And these high fidelity simulators are so incredibly high tech that they give students real life experiences in training so that they're ready to safely care for patients in a clinical setting. We're working together from an occupational therapy, a social work, and a nursing perspective to really all collaborate in that interprofessional team and discuss what we can do to ensure that this patient is going to be safely ready for discharge today.
120 over 80 would be like a normal read, so
It's pretty perfect.
All right, so next I'm going to give you a little sneak peek behind the scenes and I'm going to show you our control center. So we're going to come right into this space. In here, our faculty members can be interacting and really setting the stage for this clinical scenario. So Dr. Dahlman is controlling, observing the students, assessing their learning, and then giving those students feedback. So if we're giving the correct medication, if we're assessing that patient's pain in a timely manner, this patient's vital signs will stabilize and the students will see the difference that their care makes immediately for the safety and the care of this patient. You can see it's a very high-tech control area, so Dr. Dahlman can both listen and hear all of the student conversations and interactions, and she can be the voice of the patient. So if the patient has a question, she can speak up on the patient's behalf and be sure that the student team is really keeping the patient at the heart of what they're doing today.